Good morning, Think Like Einstein class. Barbara, Jose, and I, Chris, will be informing you all about how getting vaccinated and seeking treatment can help lower the duration of long COVID and reduce symptoms. Our issue questions the effectiveness of the treatment plan regarding long COVID and the symptoms the disease presents to its host. The sooner you get diagnosed and treated, the faster you get treatment and you can go back to your life and shred on the guitar. In this presentation, one of our people diagnosed is a guitar player.
In this slide, which focuses on frequency and duration, in this slide, we see a comparison between long COVID-28 and long COVID-56, who are the patients, with the x-axis being duration, whereas the y-axis is frequency. Focusing on graph A, we witness both genders, which fall under LC28 and LC56. They experience a variety of frequencies regarding long COVID. Those that tested negative experienced the highest amount of frequency and a low duration, who were LC28. Whereas those that tested positive experienced the low frequency yet a much higher duration, who were LC56. And the next slide, which focuses on control versus treatment group, which is a 40-day experiment conducted into two groups. One is a control group, which do not have the medication in their system, whereas treatment group does have the medication in the system. The idea was to have both a treatment group and a control group to test their sense of smell. The treatment group fared having less severe hyposmia compared to the control group from day 1 to day 40. On day 20, the treatment group has 5 patients already at normal performance. On day 40, however, 3 patients from the control group still suffer from mild hyposmia, whereas 7 patients have moderate hyposmia to ad nausea.
On this slide, we will be focusing on long COVID syndrome. This graph measures a variety of symptoms in categories from systemic to dermatologic. The population is 100 and responded to each of the categories where the majority shared all the same symptoms. These symptoms occurred at some point in their lives before seeking treatment. When looking at graph A, you will see that over 100% of the people who experience symptoms related to their systemic system. Graph B will show you that about 47% of people experience symptoms related to their reproductive, genitourinary, and endocrine system. Graph C will show you that about 96% of people experience symptoms related to their cardiovascular system. Graph D will show you that about 94% of people experience musculoskeletal symptoms. Graph E will show you that about 22% of people experience immunologic and autoimmune symptoms. Graph F will show you that about 92% of people experience hint symptoms, which are symptoms related to their head, ears, eyes, nose, and throat. Graph G will show you that about 93% of people experience pulmonary symptoms. Graph H will show you that about 86% of people experience gastrointestinal symptoms. Graph I will show you that about 59% of people experience dermatologic symptoms. In conclusion, there are a lot of factors to consider when it comes to long COVID. The best thing you can do is when you're starting to come up with something is to visit your doctor, because the sooner the better. Remember to act now. We want to urge people to consider seeking out treatment to shorten the duration of COVID and to reduce the risk of it being spread to others as well.